Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article entitled Clinical Characteristics of Patients with Lung Adenocarcinomas Harboring BRAF Mutations by Paik and colleagues. My name is Dr. Pasi Yanda, and I'm an Associate Professor of Medicine at the Dana-Farber Cancer Institute in Boston, Massachusetts. My oncologic specialty is thoracic oncology. This article by Paik and colleagues examines the clinical characteristics of non-small cell lung cancer patients whose tumors harbor somatic mutations in BRAF. It has previously been established that in non-small cell lung carcinoma, the frequency of BRAF mutations is approximately 3%. Unlike in melanoma, where BRAF mutations almost exclusively occur at the V600 position in exon 15 of BRAF, these mutations have been detected in both exons 11 and 15 in non-small cell lung carcinoma patients. To date, BRAF mutations have only been detected in lung adenocarcinomas as opposed to other lung cancer histologies. In the current study, the authors examined 697 lung adenocarcinomas. They evaluated the cancers using mass spectrometry for mutations in EGFR, KRAS, BRAF, and for ALK rearrangements. They detected EGFR mutations in 24% of patients, KRAS mutations in 25% of patients, and ALK translocations in 6% of patients, consistent with prior studies. For BRAF, they evaluated for three specific mutations, V600E, G469A, and D594G. Although these are the common BRAF mutations in non-small cell lung carcinoma, they do not account for all of the known BRAF mutations, and hence the analysis may have missed some non-small cell lung carcinoma patients that harbor BRAF mutations. Overall, the authors detected BRAF mutations in 18 patients with lung adenocarcinoma. 61 of these mutations were detected in exon 15, with V600E being the most common, while the remaining were detected in exon 11. BRAF mutations were mutually exclusive, with mutations in EGFR and KRAS, as well as with ALK rearrangements. Unlike with EGFR mutations and ALK rearrangements, both of which are more common in never and limited former smokers, the patients with BRAF mutations in this study were all either former or current cigarette smokers. The BRAF mutant tumors were not unique in their histologic characterization. The authors next examined the clinical outcomes of BRAF mutant non-small cell lung carcinoma patients. Of the 18 patients, 10 had advanced disease, and their outcome was not significantly different from advanced non-small cell lung carcinoma patients harboring EGFR mutations, KRAS mutations, or ALK rearrangements. Intriguingly, 3 of the 10 patients, all with V600E BRAF mutations, had received erlotinib as their first-line therapy for advanced non-small cell lung carcinoma patients. 2 of the patients had progressive disease as their best response, while the third had stable disease. Albeit a small sample size, the data suggests that patients with BRAF mutant non-small cell lung carcinoma may be similar to those with KRAS mutations, where the likelihood of tumor response with EGFR inhibitor therapy is exceedingly low. This is analogous to cetuximab-based therapy in colorectal carcinoma, where the response rates are less than 5% in patients with KRAS mutant or BRAF mutant colorectal carcinomas. Currently, there is considerable interest in studying BRAF mutations due to the exciting clinical efficacy of a BRAF inhibitor, PLX4032, in melanoma patients whose cancers harbor the V600E BRAF mutation. It is presently not known if BRAF inhibitors will be clinically effective in non-small cell lung carcinoma patients harboring BRAF mutations, but the question is currently being investigated. Systematic genotyping efforts, such as the one used in this current study, will be necessary to first identify the appropriate patients. Whether BRAF mutant non-small cell lung carcinoma patients represent a unique genomically defined subset of lung cancer patients where specific kinase inhibitors will be therapeutically effective, analogous to both EGFR mutant and ALK translocated non-small cell lung carcinomas, remains to be determined. The future is bright for molecularly targeted therapy in lung cancer, and we eagerly await the findings from the ongoing clinical trials. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.